Welcome to Part 2 of Catastrophic Incident Planning. Here we will discuss the various components of the Catastrophic Incident Plan. A Catastrophic Incident Plan should be developed in addition to your Emergency Action Plan through athletics and/or sports medicine. This is in addition to your Emergency Action Plan because the Catastrophic Incident Plan will outline what to do after a catastrophic incident occurs, whereas your Emergency Action Plan outlines what to do in the case of an emergency on or off field in athletics. To manage a catastrophic incident, one should be sure to get all pertinent facts regarding the incident accurately and promptly. You should respect the dignity of the individuals involved. You should have immediate communication with the catastrophic management team members. And only members of the catastrophic management team or individuals they designate should speak on the incident to family members, media, other staff members, student athletes, or coaches. A chain of command is imperative to be developed in a catastrophic incident plan. For example, you can outline each member of the catastrophic incident plan and identify whom they should contact. For example, the athletic director should notify or will be notified by the head athletic trainer of a catastrophic event. This may change depending on the incident because the athletic trainer may find out about the catastrophic incident first, especially if it's on field or on court, or the incident may occur outside of athletics and the athletic director may find out first and need to contact the athletic trainer. The AD can notify or be notified by the vice president for student affairs or the principal of the high school. The AD should notify or be notified by the head coach if an incident is related and is it during non-practice participation or when the coach may not be present. And the AD should notify the sports information director and the faculty athletics representative if applicable. Additionally, the head athletic trainer should notify or be notified by the AD, should notify or be notified by any other assistant athletic trainers on staff, should notify the team physicians, and notify counseling services, the insurance specialist, and/or the campus chaplain when applicable. Again, for example, a principal at a high school can notify or be notified by the athletic director, can notify law enforcement if necessary and not already involved, and can notify university legal counsel, the VP for Human Services, and other personnel. A communication chart is a good idea to implement in a catastrophic incident plan, so therefore all personnel involved in a catastrophic management team know whom they should contact. In addition to the communication chart, emergency contact numbers should be listed and provided in the catastrophic incident plan. These should not just be office phone numbers. They should be personal cell phone numbers because very often catastrophic events may occur outside of normal working hours. It is also important that a catastrophic incident plan identifies who will call the parents or family members of the individual involved in the incident. Usually this will be an administrator, but either way, the person who will call parents or family members should be identified in advance within the catastrophic incident plan. Very often this may be a principal or superintendent at a high school, or a vice president for student affairs, or president of a university. This individual should make sure they have all accurate information before contacting parents and family members. You should also take into consideration HIPAA. If an individual is over 18 years of age or older, and the catastrophic injury occurs and the patient is still able to give consent verbally, you should ask first. Additionally, it should be identified who will call a meeting with the team and who will be present for this meeting. In addition to chain of command, the catastrophic incident plan should outline each personnel involved and their specific roles for managing a catastrophic incident. For example, an athletic director should be responsible for contacting all appropriate personnel as per the flowchart, and maybe should be responsible for collecting any equipment involved in the incident, such as sports equipment, helmets, or pads, and secure them in a locked area. The head athletic trainer should also be responsible for contacting specific personnel as per the flowchart. If the incident occurs during athletic participation or travel, the athletic trainer should stay with the athlete until appropriate administration or family arrive. Or, this should be specifically outlined in the emergency action plan, whom will go with an athlete to the hospital in an emergency. The head AT or athletic trainer involved should complete all documentation as applicable. And lastly, they should coordinate with counseling services or the team's sports psychologist to plan support services for those involved. Furthermore, the vice president for student affairs or the principal of the school should contact appropriate personnel, again as per the flowchart, evaluate the situation and contact the family of the individuals involved, and contact and meet with media relations and/or the sports information director to discuss public communication of the incident. Coaches should organize team meetings as soon as possible following the incident, once the catastrophic incident plan has been initiated and support services are arranged by the head athletic trainer. And the coaches should encourage athletes not to discuss the incident until cleared to do so, including on social media. The counseling services or sports psychologists on the sports medicine team should organize and plan initial meetings or a grief counseling session, as well as organizing and planning subsequent team group counseling sessions. This may be done weekly or bi-weekly, whatever is outlined in the catastrophic incident plan. There should also be daily and 24 hours availability of counseling services for athletes and personnel involved. Away contests are something to specifically consider in your catastrophic incident plan. When an athlete has to go to the hospital during travel, is this outlined in your emergency action plan? Who goes with the athlete? What if you're the only athletic trainer there and the game needs to continue? Who will stay with the athlete behind when the bus brings the rest of the team back to the home school or university? Who eventually relieves that person? All of this should be identified in a catastrophic incident plan. Additionally, it may be important to document who is traveling during an away contest. Seton Hill University, given their bus accident years ago, has instituted an app in which the coaches will check athletes and other personnel in using this app live time and will identify who is on the bus traveling every time they get on and off a bus. This can also be instituted using ATS or sportswear through your institution. In addition to chain of contact, as well as specific roles immediately post-catastrophic incident, arranging support services for athletes and athletic department personnel immediately after the incident occurs is arguably one of the most important factors in a catastrophic incident plan. Those affected by a catastrophic incident will require initial grief counseling to debrief the athletes, team, and athletics department personnel involved and make sure everyone is aware of the grieving process. Preferably, this grief counseling is conducted with someone the team is familiar with and is trained in grief counseling and psychological services. However, keep in mind that the athletes will likely first turn to coaches and athletic trainers for support. These individuals should be prepared to provide this support and refer the athletes to the appropriate mental health personnel. Some other support services may include team group counseling as well as individual counseling and therapy. It's important to point out that the student athletes will be more likely to accept therapy, counseling, and group counseling if it's from someone they're familiar with. This furthermore suggests the point of hiring a sports psychologist or initiating a sports psychologist within a sports medicine team. This person could be someone the student athletes know and feel comfortable with, that later, should unfortunately a catastrophic incident occur, they will feel comfortable getting the grief counseling and support they need from this individual. Many of you may be thinking, okay, but our sports medicine team does not have a sports psychologist. That's not uncommon, unfortunately. But many schools and universities do have different options to implement having a sports psychologist on their sports medicine team. Here are some various options. First, consider a local sports psychologist. Could this person be a part of your sports medicine team, even if they're not directly affiliated with the school or institution? They could potentially provide services in return for referrals to their private practice. This is often how contracts are developed with team physicians, such as orthopedic physicians, at institutions or universities. What about an on-campus faculty member who is a licensed psychologist with their own practice as well, that may be able to, for certain credit hour releases at the institution, provide services specifically to the athletes? If they're not already trained in sports psychology, maybe the university will pay for them to get additional training in specifically sports psychology in order to further provide those services at the university. Another option could be maybe there's a local university with a sports psychology program, and there may be master's or doctoral level students in counseling or psychology who may be able to provide services as they're looking for internships or clinical experiences while being supervised by a licensed psychologist through their program. It's also important to consider that your university or school may have specific contract issues regarding who can provide psychological services at a university. This is something to consider when initiating the implementation of a sports psychologist on your sports medicine team. It's probably best to start with your on-campus counseling services or your school psychologist to ask for suggestions of someone in the area or possibly on campus who has the skills to be able to provide services as a sports psychologist for your sports medicine team. As athletic trainers have psychosocial skills that may be valuable in the overall mental health of athletes, it's important that we're also implementing these skills post-catastrophic incident. These skills include both recognition and referral of athletes struggling with mental health issues. This protocol should already be a part of your policies and procedures and your emergency action plan, such as your emergency action plan for a suicidal athlete. Remember, it is our responsibility to recognize signs and ask for symptoms of mental health issues such as depression, anxiety, post-traumatic stress disorder, and alcohol and substance abuse, specifically after a catastrophic incident, as these issues may become more prevalent. Note that many athletes may end up struggling with what is known as adjustment disorder or situational depression. This is when an individual experiences grieving symptoms that are similar to depression, but that don't get better within a 3-month period. Keep in mind, we do not diagnose mental health issues, but if we're screening for depression-type symptoms and they're not improving in just a few weeks after a catastrophic incident, this would potentially be a red flag to refer to a mental health provider. Athletes and individuals in general are at high risk of suicidal ideation and attempts if suffering from adjustment disorder compared to even regular major depressive disorder. What are some things we can do in recognition and referral of mental health issues post-catastrophic incident? You could implement the use of a self-report screening inventory to screen for depression symptoms or post-traumatic stress disorder, anxiety, etc. This could be put into your catastrophic incident plan, such as you will implement depression screening or a clinical psychological interview by a sports psychologist or licensed psychologist at 1, 2, 3, 6, 9, and 12 weeks post-incident, for example. At 12 weeks, or from 3 weeks on, athletes may be at risk for adjustment disorder, as we previously discussed. Again, for referral, do you know who you're referring your athletes to? Is it the regular counseling center? Is there a specific sports psychologist, a grief counselor, post-catastrophic incident, if we're talking about the death of an athlete? Do you have a working relationship with that mental health care provider? These are all questions that should be answered before a catastrophic incident occurs. Lastly, post-catastrophic incident, everything should be documented. You should have specific catastrophic incident forms that can outline exactly what happened and who called whom, etc. Here's some examples of some catastrophic incident plan documentation forms. One is going to be an emergency notification contact form, so it discusses whom contacted whom and at what times, who contacted the family members or the parents, what was the contents of that conversation, etc., as well as a general reporting form about the emergency or catastrophic incident, what happened, the outcome or follow-up, that should be signed by the athletic director, head athletic trainer, and/or school principal. Here are some other considerations that may be generally overlooked in the development of a catastrophic incident plan. Will someone from the institution or university assist the parents or family with arrangements to get to the athlete? What if the athlete's from across the country? Will the university or school assist in the hotel stay and arrangements for the family? Will someone accompany the parents or family members to the morgue in the case of a death of an athlete? Who will that be? What about team travel to the funeral? Will buses be arranged? What about funding for this? Additionally, who will arrange the canceling or rearrangement of athletic events and schedules? This wraps up catastrophic incident planning. At this point, you should ask yourself, does your institution or clinical site have a catastrophic incident plan for athletics? Will you be the rockstar leader when something tragic happens, or will you be scrambling post-incident? Here are some references that you may use to further your education on catastrophic incident planning. Please continue on in the module.